Hello and welcome to a revision session. Today we're revising 19th century public health, in particular the reforms. What were they? So let's start by recapping. We're going to have a look at public health before the reforms in the early 1800s. In the early 1800s, a process of industrialisation had happened where lots of factories and machines were built. As a result of industrialisation, there was a process of urbanisation, which is when many people moved from the countryside into the cities. Most people in the 1800s ended up living in cities, big cities like Manchester, Liverpool and London. As a result of a sudden move of lots of people to live in cities, there was overcrowding where people were living. Many people would be living in back-to-back housing, where there was no running water in houses. Instead, there was a shared water pump and a shared toilet as well. There were no toilets in normal houses. There would be a toilet that a whole street would share. The sewers that were built very quickly, and they were open, a bit more like a river than the closed sewers that we know today. As a result of this, there was frequent outbreak of diseases such as cholera, diphtheria and tuberculosis, as germs spread rapidly in these overcrowded and dirty conditions. At the time, people did not know about germs. Remember that it wasn't until 1861 that germs were discovered by Pasteur, and 1864 that he actually proved his idea. Major outbreaks of diseases such as cholera caused deaths in the years 1831 to 2, 1848 to 9, 1853 to 4 and 1865. Each time there was an epidemic, an outbreak of this disease, around 26,000 to 53,000 people died. Despite this, at the time, there was a practice of laissez-faire. This was the idea that the government should just let things be, that it wasn't their job to look after people's health. It was their job to run the country, and therefore they weren't interested in helping people in terms of public health and dealing with these massive outbreaks of disease. So what caused the first major attempt to reform, which means change, public health in 1848? Why did the government suddenly take action? Well, in 1842, a civil servant, which means someone who works for the government, called Edwin Chadwick, wrote a report on the sanitary conditions, which means the cleanness of the labouring population, so the working people. So he's writing about the cleanness of the working people. And he did this because he worked for some people on the Poor Law. And he came to the conclusion that the government would save lots and lots of money by improving the health of people who worked, because they'd have to pay less taxes to make up for the people who weren't working who were sick. So save money by improving the health of the working people. And they thought they could do this by rebuilding the sewers or improving the sewers, improving the water supply and making sure it was clean, and setting up a public health board who would be in charge of the public health of the whole of the country. And this led to a new law being passed in 1848. It took a while because a lot of the government was still in favour of laissez-faire, which we talked about before. So they didn't want to take action. They thought it was people's own responsibility to look after their health. But by 1848, after another cholera epidemic, the government passed the Public Health Act. And this was not compulsory, but it was the first major attempt to reform, to change public health. It said there should be a national board of public health that was an organisation that would think about what should happen to improve health across the country. And if 10% of people in a local area petitioned or voted for the law to be in place in their own local area, then a local board of public health will be set up. So if 10% of people who paid taxes said they wanted local area to be made healthier and cleaner, then they would make sure that there was a local body put in place, and they would improve and check as well sewers and water supplies. Unfortunately, only 103 towns actually used the Public Health Act, probably because it wasn't compulsory. And in order to get the money to check the sewers and improve the water supplies, they had to put taxes up, and that was very unpopular. So by 1854, the 1848 Public Health Act had been abolished, had been ended. So what caused further attempts to reform public health after the failed attempt that ended in 1854? Well, one big thing that happened was the Great Stink. The Great Stink was an event that happened in London in 1858, and it was where the River Thames dried up and it stank of sewage, which is obviously what was polluting the water. Now this affected the government because the smell was so bad they weren't able to do their job. And of course they were particularly worried because at the time, in 1858, it's before germ theory, and instead people believed miasma theory, the idea that bad smells caused illness. So for example, in this source here you can see Father Thames, this figure here, is strangling the offspring of the Thames, so it's just supposed to be people who are drinking the water because they think that the River Thames water is deadly because it smells so much. They think bad smells caused illness. So as a result of the Great Stink in 1858, the government gave £3 million for the London sewers to be rebuilt, and a man called Bazalgette was put in charge of rebuilding those sewers, and he did it in the years 1858 to 65. So that was a major attempt to reform public health and was a step away from laissez-faire. Although it's worth noting that this was only in London where the government had been affected. In 1861, after Pasteur passed germ theory, and in 1864, after he proved it was correct, Chadwick and Snow, two individuals who talked earlier on, so Chadwick, who said his report on sanitary conditions, the need for sewers and water supplies to be reformed, and Snow was the man who discovered that cholera was spread through dirty water, were both proved right, that dirty conditions, which harbour germs, was what was causing disease. As a result of this scientific proof, some people were more willing to pay for reform to health now because they realised that dirty conditions really did cause illness. It wasn't just a theory. As a result of this, by 1875, a series of new laws were passed. The most important one was the Public Health Act. And this was a step forward from the 1848 Public Health Act because it was a compulsory law, which meant people had to follow it. And it said that sewers and water supplies should be reformed and rebuilt, and also there should be inspectors who went around checking that the sewers and water supplies were in good order. It wasn't entirely popular, as it meant that people had to pay for these reforms and for the inspectors, which meant that there were extra taxes. So some people were not happy about these changes. Other laws that were passed in the 1870s include the 1875 Artisan Dwelling Act. It was another attempt to improve public health, but this was not a compulsory law. It suggested that housing conditions should be improved and things like pavement and lighting should be available, and it said back-to-back houses shouldn't be built anymore, but this was very expensive, and to rebuild housing areas would be very expensive. So this wasn't a particularly influential law, unlike the Public Health Act. And there were a series of other laws as well, for example against poisoning, putting poisons in foods and polluting rivers, which were also passed in the 1870s, as a result of the idea that germs really did cause disease, and therefore something should be done to stop that from happening and from causing diseases. However, there were still some limitations. For example, although the Public Health Act was compulsory, it took a long time to reform things such as sewers and water supplies. As we saw in London in the 1850s and 60s, it was just under 10 years that it took to rebuild those sewers, and in the same way to rebuild and reform sewers and water supplies across the country took quite a long time. Another important cause of change was the 1867 Reform Act. And this didn't reform health, it reformed the right to vote. So working men could now vote for the first time ever. Previously it had just been the richest people. And as a result of that, a series of reforms happened in 1906 to 1914, when the Liberal government came into power. The Prime Minister was called Lloyd George, and he was part of that Liberal government. And the Liberals were voted for mainly by working class people, and therefore they had to try and please them. And as a result of that, they passed a series of lots of different reforms to public health, which would make people healthier, because they knew this would please the working class. For example, in 1906, they passed the Free School Meals Act, which meant that children in schools could have free access to meals. In 1907, they passed the Medical Checkups Act. So in schools, children would have free checkups with nurses and doctors, and also new mothers would get help from nurses knowing how to look after the health of their babies. In 1908, for the first time ever, the Old Age Pension Act was also passed, which meant that people aged over 70 years old could now have access to a small pension, which meant a little bit of money now they were too old to work, which could keep them out of the workhouses. And in 1909, there were housing reforms, which banned the building of back-to-back housing and encouraged builders to have proper training before they were allowed to build new houses. And in 1912, free medical treatment was allowed in schools, so if children needed treatment, they could have it for free without paying in schools. Not all of these reforms were popular. For example, if you look at this source here, you can just about make out on the side of the boat, National Insurance Bill. And this is Lloyd George at the head of the boat here, he's sailing it out to sea. And you can see this cartoon's trying to say that people were against the National Insurance Bill. Some people, especially rich people, and you can see rich people in the boat here, were worried about the cost in taxes of the National Insurance Bill. Which was a law also passed in the early 1900s by the Liberals, which said in 1911, that said that when people were sick, if they worked, then they would be given a little bit of money to get by until they were able to work again, so they wouldn't have to starve whilst they were ill. But you can see that this was not a popular law because it meant that the rich had to pay more taxes and they didn't want to pay for the poor. There's still an idea of laissez-faire. And also, even some people who were poorer and maybe working class, not even they necessarily liked all of the laws that were passed to try and help their health, because they too had to pay extra taxes, and some of them felt that they couldn't afford it. Laws like the Old Age Pension Act in 1908 were also unpopular with some. This cartoon here shows an old Conservative Prime Minister with a large dog with a pension written on it. He had just retired in 1909 but was against the Old Age Pension Act. And this here is a working class man, and you can see on his dog it says Old Age Pension, and you can tell that his pension's much smaller because his dog is much smaller. This cartoon is supposed to be making fun of the fact that the Conservative Prime Minister was complaining about the cost of having to pay a little bit of extra tax to pay for other people's pensions, because actually these people weren't getting anything anywhere near as much as the other Prime Minister was. And it shows that not everyone was happy with those pensions. This is a poster made by the Liberal government, so obviously it's going to support these changes that they put in place. But you can see for some it was the dawn of hope, the start of hope for change, these new laws, because they really did help people. So you can see national insurance against sickness and disablement. And you can see this man here is supposed to be looking relaxed because he knows that he can have a little bit of money to help him through, prevent him ending up in a workhouse whilst he's ill. And these are the main reforms of the period of the 19th century where we're looking at public health from the 1800s to 1914. And so although public health had come a long way from laissez-faire in the beginning in the 1800s to the series of reforms that the Liberals passed in 1906 to 14, it wasn't until 1948 when the NHS was actually set up and public health healthcare was free for all. Okay, try and have a go at doing some source questions using this information, or have a go at making some notes or flashcards to help you with your revision.